Acute respiratory distress syndrome always will be non-cardiac. Said that it means the patient has high chance to have high level of bacteremia as well. Or renal complications of the malaria, ultimately it will lead the patient to go for hemodialysis. Severe anemia. Now you can ask me, doctor, why the patient is developing anemia here? Might be due to the hemolysis, okay? Might be due to hemolysis. So I mean the features of the hemolysis. We'll discuss later actually. So these are the features of the severe malaria, okay? If those are present, we should call it the severe malaria. By the way, what are the complications? Like if the patient comes up with only complications, yes, complications again. Complication means severe malaria. So either these five or the patient comes up with complications, we should call it a severe malaria. So what are the complications the patient might develop here? The complications like that, one is the brain complication, one is the lung complication, one is the kidney complication, and the final one is the blood complication. Okay, so you know these are the involvements in malaria. Okay, so in our exam day you should look for whether the patient is developing any sort of complication in these four, right? So what are the complications the patient might develop? Yes, in case of cerebral malaria, I mean the brain malaria, the patient might develop seizures, very important, or simply the patient might be in coma. So seizures, very important. Patient comes up with fever and seizure. It doesn't mean that all the time it's meningoencephalitis. Sometimes you need to exclude malaria when there is a typical travel history. Okay? So seizures and coma, number one. Number two, in case of lung problem, the patient might develop ARDS. What does that mean? Acute respiratory distress syndrome. By the way, always remember, in case of ARDS, actually this is nothing but a case of pulmonary edema. This is nothing but a case of pulmonary edema. But what it happens for us, that whenever there is a pulmonary edema, we do always think might be exactly. But remember, in ARDS, there will be no heart failure. So ARDS means acute respiratory distress syndrome always will be non-cardiac. Okay? So pulmonary edema evidenced by the normal echo findings. Okay? So the patient is having pulmonary edema, but ECG and echo, these are normal. And once again, as the patient is having pulmonary edema, why are we calling it the distress syndrome? It's because there is low level of oxygen saturation. Yes, so pulmonary edema with low saturation with other findings or other underlying clue for developing ARDS like fever, pneumonia, something like that, or even this, the malaria. Okay, so this is the lung complication. What about the kidney complication? As you know, in case of AKI, when you're calling it the AKI, I mean the kidney is injured acutely, abruptly. So the patient might develop metabolic acidosis. Okay, so the patient metabolic acidosis, and we always know in case of metabolic acidosis, the treatment ultimately it is hemodialysis. Ultimately the treatment is hemodialysis. So renal malaria or renal complications of the malaria, ultimately it will lead the patient to go for hemodialysis. Okay, so be ready for this answer as well. By the way, the other thing is that the patient will develop the black water fever. Exactly, black water fever. So passing, you know, as because we have, yes, there is hemolysis, yes, as there is severe hemolysis, so ultimately hemoglobinuria that is causing the black water fever. Black water, I'm not saying this is hematuria, this is black water fever, I mean the hemoglobinuria. Okay. So in case of AKI metabolic acidosis, the patient might need hemodialysis and the black water fever. Okay, what about the blood complication? Yes, the blood complication is like that. The patient might develop the DIC, disseminated intravascular coagulation. And disseminated intravascular coagulation, this is actually a misnomer. Why I'm saying this? Because disseminated intravascular coagulation, actually this name shouldn't be named in this way, that this should be named as disseminated intravascular coagulation and bleeding. Okay, so in DIC you will face both the things. I mean, there will be unnecessary coagulation, there will be unnecessary bleeding. So you don't know that in your case of the DIC, what is the ultimate thing you will face? Might be you're facing bleeding, might be you're facing coagulation. So always be careful regarding this one. So in case of the DIC, might be a simple thing they're giving to you, like simply bleeding. So it's not always the case will be about the coagulation problems, like in the bleeding problems as well. Here in the first slide, you can see in case of severe malaria, the parasite level is more than 2%. Okay. By the way, remember this one regarding the 10%. When the parasite level is more than 10%, then they are saying no need to treat the patient, rather go for plasma exchange. So if there is more than 10%, the parasite level more than 10%, go for PEX, I mean the plasma exchange. No need to give any kind of medication. Okay. So now we need to know that in case of severe falciparum, when the parasite level is more than 2%, the WHO recommendation for the treatment is here not the oral, rather the IV treatment. So remember the IV, intravenous. What is that? The artesunate. Artesunate. Remember, we are not saying the ACT, oral ACT. I mean, not the oral artemether based combination therapy. Directly IV artesunate. This is the simple answer. So WHO recommends now the using of the IV artesunate. And as I've said it, if you can appreciate the parasite level is more than 10%, not the 2% here, then simply the PEX, plasma exchange. Okay, so it does mean the patient now needs plasma exchange. By the way, in case of plasma exchange, don't we actually treat the patient? Okay, of course we treat, but the main treatment is plasma exchange, not any medication. Okay, so plasma exchange, then you can give the medication as well. And a very controversial issue here, why a patient of malaria develops shocks? Yes. So what about the septic shock? I am saying parasitemia, not the septicemia. So what kind of shock in case of malaria the patient will suffer from? Actually, this is the septic shock. Why? This is not the malaria which is causing the septic shock. They are saying in case of malaria, when there is high level of parasite in the body or in your serum or in your blood, you said that it means the patient has high chance to have high level of bacteremia as well. I'm not saying all the time the patient will be having the bacteremia. If somehow the patient is having this level of height or developing the high level of bacteremia, ultimately the patient will be in shock. So patients of malaria, if they develop shock, it does mean the patient needs antibiotics as well. Okay, so this is not due to the malaria actually. Okay, so this is the high level of the bacteremia which is causing the shock here. So remember this thing as well.